When the pandemic hit New Mexico, the state moved to set up field hospitals to handle the overflow. But when cases started surging over the past month, staffing became an issue. Now the state finally has a plan to open the old Loveless Hospital on Gibson. Here's News 13's Gabrielle Burkhart.
The state's been paying millions of dollars to rent the empty Gibson Medical Center in Albuquerque. Today, they're opening that site to a handful of recovering COVID patients.
We didn't need as many of those resources, but I'll tell you, I would rather have it, ask for it, make it available, and be prepared.
That was back in May, a month after the state locked into a one-year, $8.6 million lease to rent the vacant Gibson Medical Center in southeast Albuquerque.
We had a very aggressive 14-day construction timeline for this project.
The Army Corps of Engineers worked quickly to transform the site into an alternative care facility for COVID-19 patients in the event hospitals needed overflow space. For months, the facility wasn't needed until now.
Our local hospitals are stretched beyond their capacity. This site will provide support for the overflow. We'll be able to house the patients who are not quite ready to go home, but they don't need acute services in a hospital.
Starting today, the Gibson site will open its doors to 6 recovering COVID patients, but staffing is a concern.
The Department of Workforce Solutions has called over 400 people who are listed in unemployment records as healthcare workers. They've recruited 55 individuals so far, mainly nurses and certified nurse assistants, which are exactly the priority for the recruiting.
The site won't be a freestanding hospital or have resources to treat patients in need of critical care, but
we have 2 floors that provide continuous oxygen, and we have 2 floors that will be used to house persons who are isolating or quarantining.
now, capacity at the Gibson site is 180 beds, and the idea is that moving recovering patients there will free up more hospital beds. Dr. Scray says in the next week, the medical advisory team will continue evaluating expansion for the Gibson facility. Back to you.
Okay, thanks, Gabrielle. The state pays $720,000 a month to rent the facility. The current lease agreement ends in April.